Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by foot and ankle specialist, Dr. Walter Hembree. Today, we're talking about pain and discomfort in your feet and ankles, what causes it, the wide variety of treatment options, and if it can be prevented. If you wanted to better understand the part of your body that supports all of your weight and carries you through life, then stick around. Share this broadcast with your friends and family and ask your questions for Dr. Hembree in the comments. Dr. Hembree, welcome and thank you for joining us.
Thanks, Karen. Glad to be here.
Before we begin our discussion, will you tell our viewers a little bit about yourself and your specialty?
Yeah, sure. My name's Walter Hembree. I'm originally from the Atlanta area, Atlanta, Georgia, and went to undergraduate school at Wake Forest University in North Carolina, followed by medical school at Duke University, and then completed orthopedic residency at Duke University as well. Came to Baltimore for foot and ankle fellowship circa 2011-12 here at Union Memorial Hospital. Subsequently went into private practice for a number of years and then returned to this area to rejoin my fellowship program as an attending. And very happy to be here in Baltimore with my family. I have a wife and two young daughters, and we enjoy the area.
Wonderful. I'm a Baltimore native, love the Baltimore area. And I know we serve a lot of that area. So I'm looking forward to speaking with you today and our viewers about what you're doing at MedStar Union Memorial Hospital. So let's talk about the program. Can you share a little bit about the foot and ankle program at MedStar Health?
Absolutely. So at MedStar Health in the Baltimore region, we have a foot and ankle division comprised of 4 attending surgeons, myself, Dr. Guyton, Dr. Miller, and Dr. Wisbeck. And we also, in addition to patient care, we're very busy clinicians, but in addition to patient care, we have a fellowship program here training orthopedic surgeons, orthopedic residency graduates in the specialty of foot and ankle surgery. So we have 4 fellows a year who come here primarily to focus and study on foot and ankle disease and learn that specialty. We also engage in research. We have a very robust biomechanical lab here at Union Memorial Hospital, and a number of different clinical studies ongoing. So, again, in addition to the patient care side of things, we're involved in education and research at our institution.
That's great. Thank you. Let's talk about the anatomy of the foot and ankle. Can you explain that?
Well, that's a tough question because it's complex anatomy, depending on what you want to count as a bone. I mean, the foot has 26 to 28 bones. If you count what's called the 2 little sesamoid bones beneath the big toe, it's 28 bones in your foot. And again, there's upwards of 30 joints or articulations in the foot between those bones. And so if you can imagine the different forces that go through all of those joints and bones with each step you take over the course of a day, and then, a week and a month and a year, it's a tremendous amount of stress that our feet see each and every day. And so it's important to take care of your feet. And if you start having problems, I think it's important to have your feet evaluated and make sure that those problems don't get worse.
Is there a particular area of your foot that gets more weight than others? You mentioned all the 20 some bones. Is it equally distributed when you're walking, or is there certain places of your feet that might get more weight than others?
Well, I think there are certain places that get more weight. The foot is a tripod, so comprised of your heel bone and then what's called the medial and lateral aspects of your forefoot. That is what kind of balances the foot and your weight as you roll through in your gait cycle. So there are certain areas that see more force. There are certain tendons that see more force and, potentially more involved in propelling us as we walk in the gait cycle. One example would be the Achilles tendon, which depending on activity level, can see up to 10 times body weight,
Wow.
which is a massive amount of stress on one tendon. And that's why that tendon sometimes has disease process and sometimes ruptures.
Right. I feel like you hear about Achilles tears a lot. So that makes sense. Wow, 10 times the amount of weight. That's a lot. Um, who is typically affected by foot and ankle problems? Are there certain types of people, age, gender? You mentioned activity level.
Yeah, I mean, anybody. I don't think it's germane to any specific age or gender. I will say that we see foot and ankle complaints in children all the way up into very elderly patients, be it, a tarsal coalition in a kid, which is kind of an abnormal connection between bones, or, a bunion deformity in a middle-aged person, or an arthritis type picture, or a stress fracture in an elderly patient. So, again, as you indicated at the beginning of our broadcast, I mean, the foot is a very important part of the body. We stand on it, we walk on it all day long, and so again, I think anyone can have foot and ankle problems.
Yep, that makes sense. What about women? I feel like I might know the answer. One of the reasons to the answers to this question, but what about women? Are they more likely to have foot and ankle problems? Immediately in my head, I'm thinking, well, the shoes that we wear would probably cause some foot and ankle problems. That's how I sprained my ankle some time ago, wearing the wrong shoes. I would think that's a reason. Is that a reason? And are there any other reasons why women would have more problems with their feet?
Yeah, I mean, from a general perspective, I mean, I think, I don't think females are at any greater risk than males to have, just general foot complaints, but there are specific pathologies which show a female predisposition. Some of those pathologies that come to mind would be bunion deformity, for example, and a component of that has been attributed to shoe wear. And so if you can imagine wearing shoes with heels with narrow toe boxes that kind of bunch your toes together and drives force into your forefoot, that might be a predisposing factor to bunion. Women may also be at higher risk for Morton's neuromas because of that issue as well. And
what is that? I'm sorry, the second thing you mentioned.
Morton's neuroma is a pinched nerve in the forefoot, so that can cause pain and tingling on the bottom of your foot that radiates into your toes. Classically, it's found between the third and fourth toes.
Okay.
And some types of tendonitis. So, for example, what's called posterior tibial tendonitis, which is a big tendon on the inside of your ankle and your hind foot that helps support your arch. There may be a predisposition of having that problem in females, but on the opposite side of the spectrum, some things are more common in males. One of those would be Achilles tendon ruptures. I think there's a 5 or 6 times greater preponderance of Achilles tendon ruptures in males compared to females. And, other types of injuries like calcaneus fractures, for example, there's a higher prevalence of those in males.
Okay. Thank you very much. That makes sense. You've talked about some of the causes for foot and ankle pain. You mentioned arthritis and the Achilles taking a lot of the weight, bunions causing pain. What are the symptoms or warning signs that someone should look out for before that pain would occur?
Gosh, that's a tough question. I mean, I don't know what type of warning signs that. I mean, the warning sign is pain, I guess. And so I don't know that there's a whole lot to be on the lookout for before it starts hurting, generally speaking. And so, but that's probably, the vast majority of patients that come to my office, it's because of pain in the foot. And so, again, pain can be attributed to fractures, to arthritis, to tendonitis, to deformity, abnormal load distribution through the foot. That's what we do in foot and ankle surgery. That's our job, is to try and alleviate those pains with various types of treatments, be it non-operative or operative.
What about the pain threshold? So when we say pain, so you're feeling pain from something, you don't know what it is, but you're having that as a symptom, or maybe you think you might have done something and you're just not sure. What is, if you feel that level, and maybe if you could help understand what is it a personal thing, like you can't take it anymore? What level is that when you should see a doctor? And what would you do in that situation when someone just comes in and they say, I'm having pain in my ankle?
Gosh, I mean, that's a tough question because everybody interprets pain differently. I mean, we're all built differently genetically, physiologically. And so what is severely painful to one person may not hurt a whole lot in the other person. So that's a tough question to answer. But I will say in general, if the pain gets to the point where it's limiting you, you cannot do the things you like to do in life. And that may be simply walking your dog around the block, a couple times a day. That may be you can't run 20 miles because your foot hurts too bad. If it gets to the point where it's limiting your life, then that's when I would recommend you have it, assessed. And to answer the second question, when patients present with foot pain or ankle pain to my office, I mean, the evaluation starts with a basic weight-bearing X-ray, obviously to rule out, any radiographic abnormalities in the bones that might be causing the pain, and the joints, such as arthritis or stress fractures. That also helps us see the alignment of the foot and the ankle. Sometimes malalignment can be a predisposing factor to pain and problems with the foot. And once you get the X-ray, then that's followed by a basic foot and ankle exam, discussion of the symptoms. We obtain the history of the symptoms, and then we formulate a treatment plan based on that data.
Great, thank you. So we talked about some of the reasons why you would have foot or ankle pain. We have a question from our audience from Tora. Thank you for your question. She's asking about flat feet and knocked knees, which I'm not as familiar with the knocked knees. I would assume the knees are kind of hitting against each other as she walks. Is that something, the flat feet or the knees, could that cause foot or ankle issues? And then is that something that you would help with?
Yeah, absolutely. So my practice is focused primarily on feet and ankles now. I don't do any knee work, but the knock knee issue, I mean, that's a valgus alignment through the knee. And, as you alluded to, that's where the knees kind of rub together in very severe cases because they're curved inward. And that can be attributed to arthritic change in the knee joint. Sometimes it can be resultant from previous trauma and malalignment of the bones. Sometimes it's because of genetics or growth disturbance in the bone when patients were younger in their growing years. But yeah, that is something that depending on your age, probably ought to be evaluated by a total joint surgeon if you're middle-aged, adult or older. And if you're younger, a younger adult or even an adolescent, sometimes that would be a pediatric orthopedic surgeon or a sports surgeon who might see that to help discuss options in terms of bracing or even surgery to realign the knees. And then as far as the flat feet, I mean, that's a very common clinical complaint. That's something I see every day in my clinics. Again, that comes in a wide array of varieties. So, we see flat foot deformity in children that's completely asymptomatic. We see flat foot deformity in children that hurts on occasion. And, sometimes that can be treated with basic orthotics or inserts for your shoes, bracing, physical therapy. Other times it needs surgery to realign the foot. Most commonly, we're seeing that in kind of middle-aged to elderly adults. And that's called adult acquired flat foot deformity. It's kind of a classic term for it. A newer term that's being discussed nowadays in our literature is progressive collapsing foot deformity, but it's basically all the same condition, and that is where the arch loses its height over time and leads to a flat appearing foot, which can be painful. And if that type of deformity doesn't respond to bracing and therapy and orthotics, then yes, on occasion, surgery is indicated to realign the foot in an effort to alleviate that pain. And that surgery could be as simple as just kind of cleaning up a tendon, or it could be as involved as doing a major realignment and fusion of the hindfoot, depending on the deformity, other issues in the joints, whether they're arthritic, not arthritic, stiff, or mobile.
Okay, thank you very much.
Hopefully that's helpful.
Yeah, no,
hopefully that wasn't broad or detailed, that answer for her.
Yeah, no, I think that was a lot of wonderful detail. And thank you again, Tora. I do have a follow-up question about the flat feet side. So if you if you do have flat feet, you might not know whether or not you're considered a flat-footed person. Would you feel pain in the bottom of your foot, or does that affect more parts of your feet?
Yeah, again, it depends on the deformity and the severity of the deformity. So absolutely, in very severe deformities, you can feel pain on the bottom of the foot just because of the arch is so collapsed. Basically, you have a kind of a generic term for it is a pancake foot, because it's just flat on the ground. Right. And because of that, patients distribute pressure through the bottom of the foot, and particularly kind of in the hind foot and inside of the foot. And so that area can be painful. Other areas can be painful is an area on the inside of the ankle joint where the tendon lives, called the posterior tibial tendon, that can get inflamed and even torn in severe flat foot deformity, and that can cause pain. Mm-hmm. Sometimes when the foot is very severely flat, the joints get arthritic over time. Then you can get pain on the top of the hind foot or even on the outside of the foot. And in rare circumstances, in very severe deformity, the foot is so flat that you get what's called impingement on the outside of the ankle, where the fibula bone, which is the smaller bone on your ankle, abuts the calcaneus bone, which is your heel bone. And that can cause pain on the outside of your ankle and foot, and even stress fractures sometimes in the fibula. And that would be in very severe situations. So yeah, I guess in general, most of the time the pain is localized around the inside of the hind foot. But it can be in multiple areas depending on the deformity.
Okay, thank you. And a diagnostic process you would use, you mentioned earlier when someone comes in, you would perform that process to diagnose what would have caused the foot and ankle pain. So in this case for Tora, it would be she would have pain at the bottom of her foot. She would come in and you would look at her feet, because I might think that my feet are flat. They might not be. They may or may not be. So do you have some type of way in which you can diagnose someone for a flat foot just by kind of looking at them standing on the floor, or how does that work?
Yeah, absolutely. I mean, some of it's as simple as just assessing the foot alignment when patients stand. Mm-hmm. So that's part of our basic foot and ankle exam. And then we also get, as I mentioned earlier, we also get formal weight-bearing x-rays, and that's very important to help assess the alignment through the foot. Helps us see the relationships of the bones to the floor and the bones to one another. And there are different angles we can measure on those x-rays to help determine the severity of the flat foot. Nowadays, a new imaging modality that's becoming more common is called weight-bearing CT. That is a very high resolution 3-dimensional image that is obtained with the patient standing. And it's still, I would argue, a nascent technology. We're still learning about it. There's a lot being published on it right now. But I think it's going to be a game changer going forward over the next 10 to 20 years in terms of how we assess foot deformity, including flat foot deformity, and how we treat it surgically, because the detail that we can see on a weight-bearing CT scan is tremendous, and is something that hopefully in the future we will know more about and be able to use on a more regular basis at all different types of medical facilities nationwide. But right now, weight-bearing CT scans are not as common, and so they're usually found at specialized centers such as here at Union Memorial and elsewhere around the country.
Okay, thank you very much. So we've talked about some different foot and ankle pain, and and the importance of knowing what's happening because your foot and your feet hold all of your weight. What about instabilities? Do some of these foot and ankle, the pain or these particular conditions cause instability? And what does that feel like for a patient?
It's a great question. I think the most common type of instability we see in the foot and ankle areas is called ankle instability. And that occurs when patients sprain their ankle. The ligaments don't heal correctly or don't heal in a normal position. They get stretched out, and the ankle feels loose and feels as though it's giving away. Or the patient states they're constantly re-spraining just from something as simple as walking across their yard. The ankle will give out and roll on them. And so that condition we see a lot in our younger athletic population. We also see it in middle-aged patients from time to time that have been dealing with it for years, probably from a severe sprain when they were younger and never had it addressed. The problem with not treating that appropriately is that over time, as the ankle is loose and not articulating correctly and constantly re-spraining, it can damage the cartilage inside the ankle joint. And that can predispose patients to early arthritis. And when that happens, then that in and of itself is painful, but necessitates a more aggressive intervention on occasion in terms of how we approach it surgically. And that could be in some scenarios an ankle fusion, in other scenarios an ankle replacement, in addition to fixing the ligaments and rebalancing the ankle and making it stable again.
Okay, thank you. So I've heard a couple different answers potentially to this next question. I want to talk about prevention. So we have some people who might be born with different things in their foot and ankle that cause pain in the future that they couldn't prevent. I heard about just in your answer to the previous question, making sure that you get things treated properly because they could cause an issue in the future. Obviously athletes could maybe take some measures to prevent foot and ankle conditions, but can you address that or expand on that or clarify anything that I just mentioned? What are some of what foot and ankle conditions can be prevented, or what are some tips that you could share with our audience?
Yeah, I mean, that's a tough question because it's very broad. And I will say there's so much in orthopedics and in foot and ankle orthopedics in particular that we can't prevent. I mean, you can't prevent an accidental fall and breaking your ankle, or an accidental jump and rupturing your Achilles tendon. There are things that, potentially could be prevented by wearing more appropriate shoe wear. So, maybe perhaps avoiding, high heels with narrow toe boxes might limit your risk for a bunion deformity. It's not to say you can't wear those types of shoes on occasion, but perhaps avoid them every day, all day kind of scenario. I think in general, wearing supportive shoes as well, just basic supportive tennis shoes with good arch support helps distribute pressure points on throughout the bottom of the foot, and might help limit risk of problems down the road in terms of things like plantar fasciitis, maybe even arch collapse and arthritis as well. Although, I mean, I'm just surmising, there's no data to suggest that to my knowledge. But, sometimes patients will get orthotics put in their shoes. Orthotics are specialized devices that can be off the shelf, so you can buy them at sporting goods stores, or you can have them custom made, custom molded to your foot to kind of support your arch, distribute pressure points, and help mitigate problems in the foot going forward. And I think if you're someone that has a family history of foot issues, or if you're a highly active person and you feel like you're predisposed to foot pains, especially along the bottom of your foot, it might be reasonable to try an orthotic and use it day to day to support your arch and try and ward off any issues.
Thank you. Yeah, on a personal note, I have orthotics in my tennis shoes. I wear them all the time because I have a flat foot, which is probably why I have so many questions about that, not just for me, but for Tora. But those orthotics, yeah, and just wearing shoes around the house because I have hardwood floors. I think that causes some foot pain at the end of the day for me. So wearing proper shoe wear with my orthotics. Also thinking about, especially with winter coming, those accidental slips are bound to happen, but being mindful of your surroundings and making sure that you're walking out of the house with the proper footwear, especially when it gets colder and there's potential for ice, would also be something that that could be considered for our viewers.
Yeah, absolutely. It's a great point you bring up. It didn't even occur to me, but ice is a major issue in the wintertime with ankle fractures, falls and ankle fractures. In fact, I was on call last January one weekend and had 16 ankle fractures come in over the course of 4 days, I think, during one of those snowstorms last January or February. And it was just, things as simple as, patients getting out too early before the temperatures warmed up, trying to grab the newspaper on the sidewalk, walk the dog, and, slip on some ice on their front steps or on their sidewalk. So it's, be careful, wear supportive shoes. If you are elderly, try and ask a neighbor or a younger family member to come over and de-ice your stairs and sidewalks going into your house before you venture out. I've made that mistake myself, walking out behind my house to get in my car early in the morning, coming into the office, and slipped on some ice. Luckily, I didn't break anything, but it's very easy to do. We're all guilty of it. And so it's just be careful and plan ahead. If a storm's coming in, put some salt down on your steps, have a shovel handy as well.
Sure. Yep. Thank you. Just wanted to remind our viewers real quick that we're talking right now with foot and ankle specialist, Dr. Walter Hembree. If you have questions for us as we continue our discussion, please post them in the comments and share this with your friends and family. As for those that have continued to listen over the past 20 so minutes, this affects anybody, and the feet and ankles are a really important part of your body. So this is a very important conversation that we're having. And we hope that you can share this information so your friends and family can help to address or prevent that foot pain or ankle pain that they're experiencing. I did want to shift gears and talk about the treatment options. And I do have a specific question from Tora, and this could help answer this question. I want to talk about the different treatment options. And she specifically asked, is there an alternative for surgery, especially if you have complex foot and ankle issues? Can you talk about those options that are available? And what are their benefits? What are the limitations?
I think she'd asked about flat foot deformity in particular last time. So, obviously we always make an attempt if we can to try and treat things conservatively before jumping to surgery.
Right.
In terms of flat feet, there are things you can do that would be conservative in nature. Certainly, a good pair of inserts, orthotics for your shoes, which we discussed previously, can be helpful sometimes to support your arch and hold your foot in what's called a more physiologic plantar position. That can help alleviate some of the pains and stresses that are going through your foot in that abnormal flat position. On occasion, in more severe deformities, some custom braces can be effective. One that comes to mind that we use frequently is called the Arizona brace. It's a custom molded leather lace-up brace that kind of locks in around your ankle and foot and helps support your ankle and foot and prevent that deformity from worsening over time. On occasion, if joints are arthritic, injection therapy can be considered as a temporizing measure. Typically, I have some patients that will come in and get a steroid injection every 3 or 4 months and manage their arthritis pain for many, many years with injections as opposed to having an operation. And then physical therapy too can be helpful. In some scenarios, gait mechanics are off, and so getting into a good physical therapist and working on your gait and stance and roll through can help alleviate pains and stave off an operation. So yeah, I mean, I guess to summarize, I mean, there's inserts, there's bracing, there's physical therapy, there's injection therapies, be it, steroid or joint lubricating type injections, or growth factor injections. There are a lot of things that can be considered on occasion, depending on the deformity, depending on the presentation, that we can try before having an operation.
What about medication?
I think some of the tried and true medications, just basic anti-inflammatories, are some of the best things that can be used for foot and ankle complaints. And one that comes to mind is called Voltaren gel. It's a topical anti-inflammatory that is now over the counter. And I find that in many of my patients, it can be effective in terms of alleviating various tendonitis complaints and arthritic complaints around the foot, because these structures are superficial in the foot and the ankle. And so I think the topical treatment sometimes is effective. Obviously, the oral agents too, ibuprofen, Aleve, these things are all over the counter, and assuming they're not contraindicated from a medical standpoint, you should always be cautious with their use. If you have diabetes, kidney disease, heart disease, these issues should be discussed with your family doctor before you undertake treatment on an oral anti-inflammatory. But these types of medications, this class of medication, can be very effective at alleviating some of the inflammation and pain around the foot and ankle.
Thank you very much. That's a good segue to a question that we have from our audience. This is from Linda. She says, I have diabetes and I have a drop foot from a previous operation. My foot has had a lot of nerve pain and it's in the right side. And sometimes it's just too hard for me to walk. And I know with diabetes, do you have medication for leg and feet pain? But it doesn't seem to work. Can you help? She says, can you help answer my question and what she could do for that?
Yeah, that can be, I empathize with Linda. That can be a tough situation sometimes. And again, I'm not privy to the details of her issue other than what was indicated in the question. But, it sounds like what she's describing, she may have a component of diabetic neuropathy. And that is where nerves in the lower extremity stop working correctly because of the diabetes. This can be painful. When you can lose protective sensation in the foot, the nerves can cause tingling and burning. There are medications that can be tried. Probably two of the more common ones would be Neurontin and or Lyrica, the quote unquote nerve medications that are designed specifically for neuropathy. They aren't always effective, unfortunately, and they do sometimes have side effects. I would say one of the most common side effects I hear about, in particular with Neurontin, is that it can make patients feel quote unquote groggy, and they don't like that sensation. Sometimes, vitamin B supplementation might be helpful with nerve pains. Again, I think the data on that's a little mixed, but anecdotally, I've heard patients, say that helps sometimes. And, last but not least, I mean, there are bracing options that can be considered with good accommodative, and that by accommodative, I mean a good soft insole to support your foot and pad the foot and avoid pressure points. And then that can be combined with a brace to help support the foot and address the drop foot component. So the foot's not slapping the ground as you walk. And, last resort would be some type of surgical intervention, depending on why she has the drop foot. Sounds like there's been some other surgeries performed already on her limb. So I don't know exactly what the scenario is there, or if she'd even be a candidate for a repeat surgery, and she may not even desire more surgery. But, there are different types of tendon transfers and on occasion fusion procedures that can be considered to help address and correct the drop foot.
Thank you very much. And thank you, Linda, for that question. Have another question for you, Dr. Hembree, from Katie. She had a foot and ankle sprain, and she's been in a walking boot since then. She also has a bunion on that foot, and she's been feeling more pain in that joint since wearing the boot. And she has an orthotic in the boot. So orthotics coming up again. which has helped, but she's wondering if that will have an adverse reaction in the healing of her torn tendon from her sprain.
I mean, if I understand the question, she's wearing an orthotic in the boot, and she's wondering if that will have an adverse
Yes.
issue with the sprain component of things that are healing. And I will say, that's really patient dependent. In general, I don't recommend wearing orthotics inside a cam boot. I find it to be a little counterproductive and sometimes can make the boot more difficult to fit and be comfortable on the lower extremity. Theoretically, if you're in a boot, that should be supportive enough of the foot so that hopefully you wouldn't need the orthotic. Now, that being said, I mean, again, it is somewhat of a patient preference issue, and I will say no brace that we prescribe in foot and ankle surgery is perfect. I mean, braces all have their issues, unfortunately.
Mm-hmm.
And one of those issues is that, they can be a little uncomfortable sometimes. And I have had over the years patients purchase inserts off the shelf or even use their already made custom inserts in a boot because they feel like the boot feels more comfortable with the insert in place. And if that's the case, I don't think there's necessarily a problem utilizing the insert in the boot. If it works for you, then I would do that.
Thank you. Yeah, it sounds like she put the orthotic in the boot because she has a bunion on that same foot, and that's causing pain from the boot. So yeah, I would imagine if you do sprain your ankle and you have to wear that boot and you have a bunion, that would cause some discomfort because the boots probably don't account for that, I would imagine.
Well, the boots can sometimes, again, if the bunion's really severe, I mean, on occasion, boots can rub. They can rub on the bunion and cause pain. And so, yeah, it's just a matter of having the boot adjusted. On some occasions, we have to try a different style boot. If she feels like she needs the insert, if that seems to make things better, then I would use it. But if it's making it worse, then I would take the insert out of the boot. That'd be my recommendation.
Thank you. And thank you, Katie, for that question. So thanks again, Dr. Hembree, for talking about all the different treatment options. I want to talk about one more, and then I want to get into a little bit more about surgery, and so patients understand when that would be necessary and what to expect. But do you consider a treatment option just waiting, watchful waiting to see if the pain goes away? Or is that something where someone would come in and that's a recommendation that you have for them? Can you talk about waiting it out? What does that entail?
Yeah, I mean, absolutely. Despite all of our nice imaging modalities, be it X-ray, MRI, or CT, sometimes we cannot necessarily pinpoint an exact mechanical pathology that could be causing said pain in the patient's foot. And so when that occurs, and let's say someone comes in with just generic foot pain, X-rays look normal, MRI for the most part looks normal. We tried some boots immobilization, pain's not better. We've tried some physical therapy, pain's not better. In those scenarios, sometimes watchful waiting is just that's the next option. And there's, again, assuming there's nothing untoward on the imaging or exam, in my opinion, I think, it's not necessarily wrong to do watchful waiting sometimes, because sometimes our body over time will heal itself and the pain will just get better.
Mm-hmm.
We do see that happen, and it's patient specific,
Mm-hmm.
but I think that's absolutely on the treatment algorithm sometimes, the clinical observation or watchful waiting.
Okay, thank you. So if you do get to the point where you need surgery, can you talk about when is that time? When is surgery necessary?
Yeah, I mean, that's a decision, to be made after discussion with your surgeon, with your doctor. And, it depends on the diagnosis. Obviously, if a patient shows up with a bad ankle fracture, it's unstable, I mean, surgery is indicated in those scenarios. And that's when, we go ahead and do the operation. There are other types of diagnoses like posterior tibial tendonitis and acquired flat foot deformity, where it's not necessarily an emergency. It may be painful, but it's not necessarily an emergency. And often in those scenarios, we can alleviate the pain with bracing or with physical therapy. And so we try those first instead of jumping right to the operation. Now, sometimes the conservative treatments don't work, and the pain is still debilitating. It's limiting activities of daily living, limiting things that patients like to do in their life. And then we revisit the surgical options. And in those scenarios, sometimes patients elect to have an operation in an effort to alleviate their pain. So it's really, I guess, diagnosis dependent. It is patient dependent to a certain extent. And, it's a discussion and agreement between patient and doctor. So have that discussion with your doctor and find out, what his or her thoughts are on your foot pain, and when surgery, surgery can be indicated when the pain gets to the point where you just can't take it anymore and nothing else seems to be working.
Okay, thank you. So speaking of those surgical treatments, can you talk about the difference between what is an ankle fusion and an ankle replacement? So if you do end up getting surgery, how would you describe those two options?
Yeah, sure. So, you're talking about treatment. These treatments are for ankle arthritis primarily. So, a fusion procedure is where we make two bones grow into one bone. So we basically eliminate a joint. And a replacement, on the other hand, would be maintaining an articulation between bones or maintaining motion between two bone segments. And I will say that probably ankle fusion was the gold standard for treatment of ankle arthritis. And it still works very well, and we still do it in certain scenarios, depending on the patient's age, the diagnosis, and other issues going on in the foot. And patients can be very highly functioning with an ankle fusion, and it's very good at pain relief with high patient satisfaction rates overall. But a newer kind of treatment modality has kind of come into its own over the last 15 to 20 years is ankle replacement. It's still not nearly as common as hip and knee replacements, but the implants we're using nowadays are much more advanced, and the longevity of those implants is increasing. And so for patients that want to maintain some type of motion through their ankle joint and alleviate their pain, ankle replacement can be a very good option in certain patient age groups. And again, you just have to have a discussion with your surgeon to find out if that's the right option for you. No surgery is 100% foolproof. Ankle replacements as well, can sometimes have their issues. And I think you have to be aware that sometimes the ankle replacements fail and they have to be revised or converted to a fusion. Again, kind of depends on the age and activity level of the patient, whether or not we'll recommend a fusion versus replacement, but that's a discussion to be had with your surgeon.
Sure. Thank you. What can patients expect in terms of recovery from a foot or ankle surgery?
Well, it depends on the surgery. I think in general, there's two avenues of recovery. One is an operation where you can walk on the foot after the operation. Mm-hmm. And I would say a general category of surgery where you can put weight on the foot would be forefoot surgery, including bunion surgery. Most bunion surgeries we do nowadays, you can walk on the foot after the operation, usually in a protective shoe or boot. Mm-hmm. And there are other surgeries that you cannot put weight on the foot or ankle after the operation. And those tend to be the longer recovery and the more difficult issue for patients. In general, that includes things like fusion procedures and an ankle replacement, for example, or tendon repair in some scenarios. Any type of surgery where we need to protect the tissue while it heals and give it a chance to heal before it starts seeing those day-to-day stresses with gait, you'll be non-weight bearing. And so, mm-hmm. The non-weight bearing status after an operation depends on the operation, depends a little bit on the surgeon and their comfort level in terms of when they walk patients. But I would say on average, it's about 6 weeks, after an ankle fusion or an ankle replacement, for example. And then you progress your weight in a boot after that. The recovery is kind of a broad topic. It's again dependent on the exact type of operation performed, but usually it's either going to be weight bearing is tolerated in a protected device for 4 to 6 weeks, which is a little faster recovery, or it's going to be protected weight bearing, no weight at all, for upwards of 6 weeks. Then you start advancing your weight in a boot after that. So it could be upwards 10 to 12 weeks until you're getting back to regular shoes after a hindfoot fusion, for example.
Thank you. And that's certainly a question you could ask your surgeon as you are preparing for surgery, so you can get a better understanding based off of what you are specifically going through. What is the significance of weight bearing versus non-weight bearing? And how do you define that? Is that like full weight? Is that just a little, can you talk a little, because you mentioned that a few times. Can you talk about that a little bit more?
Yeah, I mean, non-weight bearing is what it sounds like. It's no weight. And so the significance of that is that it makes the recovery much more challenging, and you have to use crutches or a walker or a knee scooter commonly to get around. And that can be very difficult on elderly patients that have stairs getting into their house, patients whose homes have a lot of stairs inside the home, getting up and down the stairs, getting around. It makes it very challenging.
Sure.
Sometimes in our more debilitated patients that, for whatever reason, don't have much help at home, they may have to go to rehab after the operation for a period of time to help build their strength and make sure they're mobilizing safely, not putting weight on their limb. And again, that's something, and myself included, I take for granted the fact that I can walk and put full weight on both feet all day, every day. And you take one leg away, and it makes it much more challenging to traverse the world. It's very difficult for patients when they can't put weight on a limb for a period of time, even just 6 weeks.
Okay. Thank you very much. What is the long-term outlook for surgical patients? Are there any lifestyle changes that someone would need to make? I mean, there's what you just mentioned earlier. There might be some adjustments that you need to make in your home as you're recovering. But what about anything else to add to that, or anything even longer term that would need to be considered?
Well, I mean, I don't know about long term. I mean, ideally, once you recover from the operation, you can walk again. Hopefully, your life would return to normal and hopefully pain-free after the surgery, assuming things healed appropriately and it was successful. But yeah, it's a great question. I think kind of in the near term after an operation, especially if you're non-weight bearing, the thing that comes to mind is driving. Because if you can't drive, then you lose your independence. And if you can't put weight on your limb and it's the right leg, then you can't drive after the surgery. And so those patients have to rely heavily on friends and family to get around after an operation. And it may be that you have to arrange your home as well to help facilitate your recovery. That can be moving your bedroom furniture to a downstairs room so you don't have to go upstairs when you get home from the surgery. Making sure you have friends or family to go to the store for you if needed, to bring you food. Those types of things need to be planned for ahead of time before the operation.
And when you do go out and about, make sure you watch out for the for that ice and what we talked about earlier, to make sure you don't, injure yourself again if that's the cause for that surgical need.
Yeah, absolutely. And I would say too, make sure that you're wearing whatever protective device your surgeon puts you in.
Yeah,
because it's not uncommon to fall after a surgery, and most of the time, even though you're non-weight bearing, you're still in a cast or a boot to protect the leg. And most of the time when patients do fall, as long as they're wearing their protective device, things are fine. It doesn't injure whatever surgery was performed. But if you're not wearing your protective device and you fall, then you increase your risk of re-injuring or disrupting whatever surgery might have been done.
Sure. Yeah, you went through all of that. Follow the discharge instructions so you can recover as quickly and effectively as possible. That's a great tip. I know some of us can be a little stubborn sometimes, and especially if it's causing pain or it's affecting how we move around the house, it can be easy just to say, forget about it, I'm not going to wear it anymore. But it's really important that you do. Otherwise, all that work is lost, and you might not recover the way that you're supposed to. So that's a great point. So just a couple more questions for you. This has been a really wonderful discussion. I know I've learned a lot. I hope our viewers have. What about, is there anything on the horizon in foot and ankle research or technology that our viewers would be interested to hear about?
I think one thing that you hear about in the media sometimes today is 3D printing technology, and that's across all industries, but including medicine. And so this technology, I think, is going to be revolutionary, especially in orthopedics, because we now have the ability to print patient-specific implants. And by that, I mean we can take imaging of a normal leg and based off that, create a custom bone for the opposite leg. And probably one of the common pathologies that comes to mind where that's being utilized is what's called avascular necrosis of the talus. That's a bone that makes up your ankle joint and some of your hindfoot joints. On occasion, it can die and become painful, loses blood supply and dies and becomes painful and or arthritic. And so this 3D printing technology gives us the option of basically making a metal talus bone that exactly matches your native anatomy that can be implanted. And I think, that's going forward. I think this type of technology is going to be used more and more to the point where I would imagine in the future, each hospital will have, a 3D printing machine in the hospital, and patient X will come in for a surgery. They'll scan the patient when they arrive, and then they print off whatever implant they need to fix the broken bone or to fuse the ankle joint that will match that patient's anatomy exactly. I'm excited to see where that goes over the years. Yeah.
Wow. Well, thank you for sharing that. Before we go, what do you want to make sure that people take away from this discussion about foot and ankle pain?
Well, just, take care of your feet, wear supportive shoes. If you have pain, get it checked out before it gets worse. Don't live in pain. I mean, there are things that can be done to help you live a more active, normal lifestyle, and get in to see somebody and take care of it. And, I think, again, as I mentioned earlier in the broadcast, we all take for granted our feet and our ankles, but I hear it time and time again in my patients that, sustain a bad fracture or have surgery for arthritis or what have you, and they can't walk for, 6-8 weeks or longer. It's amazing how much that limits them in their life. And I hear people comment on that all the time, how we take for granted the ability to walk. And so, be good to your feet and ankles and take care of them. And that'll hopefully keep you, vibrant and active for your entire life.
Thank you. That is wonderful advice. It makes me, want to take care of my feet. And I'm sure our viewers feel the same way. So thanks again for your time, Dr. Hembree. This was a wonderful and important discussion. Thank you to our viewers for joining us. To schedule an evaluation with Dr. Hembree, you can call 410-554-6530. Thanks again to everybody. Have a great rest of the day.